mission here at Inland Naturopathic Wellness Center is to deliver healthcare that addresses the root cause of illness while empowering people to the vibrant health that they deserve.
The process starts from having a discovery call with us. That's the first step. Within that step is for us to figure out, is this a condition that we are able to treat? If that's the case, the next step is for them to come in for that comprehensive visit. We're doing a thorough health assessment, looking at any labs that need to be run based on their intake form, based on their health history and what their concern is. Within that visit, we're also setting up with them to complete any labs that we need, also giving them preliminary treatment and therapeutic recommendations as well.
We apply a variety of therapies, each therapy chosen particular to a person's needs. Some of those therapies might include chelation therapy for cardiovascular disease, prolotherapy for damaged and injured joints, almost always nutritional therapy to address nutritional risk factors, neurotherapy to help reset the autonomic nervous system. When people work with us, they no longer have to rely simply on a medication to control their blood sugar or their blood pressure, but they actually have ways to enhance their health and decrease their disease risk factors so they feel better.
There are individuals who, I know I have hypertension, I know I have high cholesterol, I want a different approach. I don't want a prescription written for me for that concern. I want a more comprehensive, natural approach, and those are the individuals who seek us out. There are those other cases where they have a bunch of symptoms. I'm so tired, I don't have an appetite, I have hot flashes, or I just don't have that get up and go as I did when I was 25. I've been to doctors and all my tests are normal. Those also seek us out because they don't know what's going on. They want that approach that will take the time. It's not a 7-minute or 8-minute visit as they would have done with their conventional doctor. Let me just write that prescription and send this person on their way, and they see them in another 6 months. We're here to listen, we're here to spend the time and be thorough with them and figure things out with them.